Well, India is reporting its biggest daily surge in coronavirus cases since the pandemic began, crossing the 100,000 mark for the first time. The majority emerge in the state of Maharashtra. That's home to India's financial capital, Mumbai. An evening curfew is being tightened there, and the lockdown will be enforced over the weekends. 7 other states are also reporting a steep rise. Hundreds of infections with virus variants from the UK, South Africa, and Brazil are being reported. Well, the rise in infections has not stopped politicians, however, from gathering large maskless crowds in election rallies like those. The Prime Minister, Narendra Modi, has held multiple rallies ahead of upcoming regional elections. Health experts are placing their hopes on the vaccination drive, but the rollout has been slow. Only 76 million Indians have received at least one shot in a population of 1.4 billion. Elizabeth Puranam has more from New Delhi.
Day on day for the past 2 months, they've gone from an average of around 10,000 cases in early February to more than 100,000 cases on Sunday for the first time in the past year. Again, Maharashtra recorded its highest number of 57,000 cases on Sunday. And Maharashtra, along with a handful of states, account for most of the cases in the country. The other states are Punjab, Chhattisgarh, Madhya Pradesh, and Karnataka. Now, here in Delhi, the cases were 4,000 on Sunday. That's the highest since last year. So Prime Minister Narendra Modi held a meeting on Sunday to review the situation, and he said that the rise was due to what he called the sharp decline in COVID-appropriate behavior, like wearing masks and social distancing due to pandemic fatigue, and also what he called the lack of effective implementation of containment measures. He is sending medical teams to Maharashtra to assess why the situation has remained the worst in the country there over the past year. He's also sending teams to the states of Punjab and Chhattisgarh to see why the death rate is so disproportionately high in those states. Now, Punjab has seen the highest number of cases of the UK variant of the coronavirus, but health officials in India maintain that the variants, whether they are from the UK, Brazil, South Africa, even the double mutant variant that's been found in India, that those variants aren't responsible for the rise in cases. They say it is because of people letting their guard down after the numbers fell as much as they did earlier this year.
Let's speak to Dr. Ishwar Gilada, who's an infectious diseases expert and Secretary General of Organized Medicine Academic Guild. He's joining us from Mumbai. Thank you so much for speaking to us. And you are saying that this second wave is stronger than the first. Why do you say that, and what are you basing that on?
See, I'm based in Mumbai, and is the capital of Maharashtra and financial capital of India. And currently, we are in the second phase of the pandemic, where it is surging every day. And yesterday we have notified almost 54% of the country's cases from the state of Maharashtra. And this has been a trend for last almost 1.5 months going on like that. So what we see today is not just days or 2 days working. It is a couple of weeks of cooking happening behind the door, or the virus has been multiplying in last 3-4 weeks manifold, and that's what we see the result today.
Why do you think that there's been such a dramatic surge in infections, considering that India did go into months of lockdown?
You see, lockdown is not a solution to prevent the surge, basically. Preventing surge is a byproduct. Why we do lockdown is to ramp up the services, medical caregivers, their training, arrangement of beds, oxygen, ventilators. So basically, lockdown is for preparedness. And now what is being used is for psychosocial impact on people, because people don't listen otherwise. So they either listen to law or they listen to some punishment. Currently, punishment is not much, so it's only some few dollars of fine. But lockdown helps people understand that there is a very serious situation. So if you say lockdown has been done longest and strictest in the world, and that would have helped, yes, that may have helped. For a gap between first surge and second surge, which is the longest gap we have seen anywhere in the world.
Okay, so what needs to be done then next? The government in Maharashtra is announcing an evening curfew. and a lockdown, yet another lockdown, will be enforced over the weekends. From what I understand, you're saying that's not enough. So what would you like to see happen?
So basically what we are looking at is a combination of three things. MTV, and MTV is not M television. It is M means masking, and that is most important. So for prevention, you have to look to the east. Look at Thailand, Cambodia, Vietnam, Singapore, Hong Kong, Japan. They have been masking almost nearly 100%, wherein India is masking is only 40%, and half of them do not use the mask properly. They do not cover nose properly. So masking is most important, and that will remain at the mainstay. The second is T. T is test, track, and treat, and that is also very important. When you diagnose cases, you have to treat them. And V is vaccination. A lot of people think that once vaccine is available, then we can prevent the second surge. The vaccine is now currently which is available, it is going to prevent the third surge, if at all. It is not going to prevent the current surge which is happening. And only if we use this combo of MTV, then we can contain COVID in a bigger way. Otherwise, we are going to have a major problem.
Okay, thank you so much for speaking to us from Mumbai.
Thank you.